Go.
Before we do the head to toe, let's start with some hand hygiene. So at this point, I'll put my gloves on, and then we can evaluate the patient. So I'll begin by introducing myself and explaining the procedure. Hello, miss. My name is Alex. I'll be your nurse for today. I'm here to do a full head-to-toe assessment. Should take about 10 minutes. Is that okay with you?
Yeah.
I'll begin by providing some privacy. If there were some curtains, I could close them right now. And to start, can I get your name and date of birth?
Christina Watt, November 16, 1994.
I could also compare that against the patient's wristband. And I know these questions are silly, but it's important that I ask. Do you know where you are?
Yes, I'm in the living room
Do you know why you're here?
to participate in your video.
And do you know what day it is?
It's Sunday.
Okay, very good. The patient is alert and oriented, ×4. Now I'll go ahead and take your vital signs. I'm going to start with your blood pressure. Is that okay?
Mm-hmm.
All right. We can rest your arm on this pillow. Put this cuff on. Okay. You can just rest that there. Just a little squeeze, okay? The patient's blood pressure is 110/68, completely normal. Take that off. There we go. Now I can go ahead and take the patient's pulse. All right, the patient's pulse is 68, again, completely normal. And now I'm going to count your respirations. So don't mind me, just breathe normally. counted 16 respirations in a minute. Again, completely normal. Now we can go ahead and take your temperature. Just gonna put this against your forehead. That's perfect. And if we had a pulse oximeter, I would also check your oxygen saturation. At this point, I'll evaluate the patient for pain. Are experiencing any pain right now?
No, no pain.
Any difficulty breathing?
No,
Any nausea? Anything like that?
no.
Okay, very good. Moving on with our assessments, I'll begin with the patient's head. So I'm just going to take a look at your scalp, okay? I'll examine the head, looking for symmetry, looking for any lesions, any abnormalities. I'll feel the back for any bumps, anything of that sort. While I'm here, I can also take a look at the ears, looking for any signs of skin breakdown, any drainage, any lacerations, anything like that. Let me check this ear. Everything looks to be within normal limits. Do you have any difficulty hearing? Wear any hearing aids, anything like that?
No.
Can I check your hearing?
Yeah.
Okay, can you close your eyes for me and tell me which ear you hear the noise in?
This ear. This ear again. This ear.
Okay, very good. Moving on, I'll take a look at the eyes. I'm just going to shine the pen light in your eye. Is that okay? Just look straight ahead. Okay. So the pupils are equal and reactive to light. The pupils are round, symmetric. Now let's look at your conjunctiva. I'm going to pull your eye down. Conjunctiva is nice and pink. Discharge in the eyes, everything looks good. Can you follow the pen light while keeping your head still? Okay, very good. Can you focus on the pen light? Now focus across the room. So the pupils are reactive to accommodation. Do you feel any numbness or tingling on your face?
No.
Is it okay if I check your face for sensation? Can you close your eyes for me? Let me know where I'm touching you.
My right cheek. My chin. Left cheek.
Okay, very good. I'm gonna take a look at your nose. You can open your eyes now. Okay, there's no drainage, no abnormalities noted. I'm gonna see if your nostrils are patent. I'm gonna listen with my stethoscope for air coming out of your nostrils, okay?
Okay.
Can you occlude your left nostril with your finger and then breathe for me? And your other nostril? Okay, very good. The nostrils are patent. Can you open your mouth and say ah?
Ah.
Okay, everything's nice and pink, no signs of inflammation. I don't see any cavities. Can you stick your tongue out? Can you smile? Frown? Can you raise your eyebrows? Okay, very good. And right now I'm looking for, symmetry. Everything looks perfectly symmetric. And the muscle tone on the face is good. Moving down, I can assess the lymph nodes. So I'll feel around behind the ears and work down to the jaw and the neck. You feel any pain or tenderness where
No.
I'm touching? None of the lymph nodes feel swollen at all. Okay, can you lean your head back? I'm just going to take a look at your neck. Can you swallow for me? Okay, the trachea is midline. And I can also, at this point, assess for jugular vein distension. So we can recline the head of the bed to 30 degrees. And Can you tilt your head 45 degrees to the side for me? Okay, just relax. I don't see any signs of jugular vein distension. Can you shrug your shoulders? Okay, very good. At this point, I can move down to the chest and take a listen to the heart and lung sounds. I'm gonna listen to your heart now. Is that okay?
Okay.
Now at the apex of the heart, I'll listen for a full minute. Got a heart rate of 68, so it's perfect, and your heart sounds are perfectly normal. S1, S2, and the rhythm is completely normal. Now I can go ahead and listen to your lungs, okay?
Okay.
So just breathe normally for me. And a deep breath. Okay. Sounds clear. Can you lean forward for me and listen to your back? And deep breath. One more. Lung sounds are completely clear, and the patient shows no signs of having any difficulty breathing. While the patient's back is visible, I'll assess the skin for any signs of breakdown, paying particularly close attention to sacrum, and the skin looks completely intact, so you can turn back over. After assessing the chest, heart, and the lungs, we can move down to the abdomen. Begin by inspection, looking for any signs of bruising, lacerations, discoloration, any distension. And then I could go ahead and auscultate. Just gonna listen to your abdominal sounds. The bowel sounds are normal and present in all quadrants. I didn't hear any abnormal sounds like a bruise or anything like that, so that's all good. I'm gonna palpate your abdomen now. Let me know if you feel any tenderness or pain when I palpate. So the abdomen is soft, non-tender. And when was the last time you had a bowel movement?
Yesterday.
Yesterday? Everything is normal, okay?
Normal.
And urination. Have you been having any abnormal symptoms when urinating?
No.
No, urine's clear, no odor.
No.
Okay. Any urinary frequency?
It's normal.
Completely normal. Okay, very good. And at this point, I could politely ask the patient if I could look at their perineal area, and while providing privacy, I would lift the gown up and inspect. So now I'm gonna assess the arms, and I'll begin by looking at the skin, checking all the surfaces for integrity. I'll take note of the color, looks completely normal. For the ethnicity, the skin is warm and it's dry. I would take note of any IV access points, and I would assess, the dressings to see if they need to be changed. And I would assess the IVs for patency, but the patient doesn't have any IVs. Can you lift your arms for me? Okay. Can you give my hands a squeeze? Nice, very strong, equal bilaterally. I would feel the pulses. Can you flip them this way? Okay, so the pulses are equal and strong bilaterally. Can you flip your hands the other way around? Check skin turgor. Skin is nice and elastic. I would look at the nail beds. Check the capillary refill. Capillary refill, well less than 2 seconds. Nail beds look healthy, no signs of clubbing or anything like that. So your arms look good. At this point, I can assess the legs. Again, I would assess, every inch of skin on the legs, looking for signs of skin breakdown. Could you lift your legs for me? Start with one leg, and now the other. Okay. Can you lift your foot towards your shin? Okay. Now push against me. Strong, equal bilaterally. I would examine the calves, looking for redness, swelling, signs of inflammation or pain upon palpation. Do you feel any pain when I touch your legs?
No, no pain.
No tenderness, no pain. No signs of deep vein thrombosis here. I would also assess for edema on the bony areas of the ankle, and the shin, and the foot. No signs of edema present here. I'm going to take your socks off, okay?
Okay.
Okay. At this point, I'll assess for the pedal pulses. They're present and equal bilaterally. I would say +2. I'll check the capillary refill on the toes. So no numbness or tingling on the feet, right?
No.
Can you wiggle your toes for me? Okay. Can you close your eyes and tell me which foot I'm touching?
Left foot. Right foot.
Okay, very good. Now make sure to check the bottom of the heels for any signs of skin breakdown. And the feet look nice and clean. They're warm and dry. Looks like they're perfusing well. Put the patient's socks back on. Now that I've completed the assessment from the head down to the toes, I could lower the bed to the lowest position, make sure the patient's call light is within reach. I can withdraw the curtain, remove my gloves, do hand hygiene, ask the patient if there's anything else I can do for you. Is there anything else I can do here?
No.
You're all set?
All set.
All right. And that concludes the head to toe assessment.